All right. Welcome back, everyone, to the Mental Health Entrepreneur Podcast. I'm your host, Rachel Harrison, and with me today is Rishi Sood. Did I say that right?
Yeah.
Did I not say that
Yeah,
right?
you got it right.
Rishi
Yeah.
Sood. He is with the Amen Clinics. So, welcome, Dr. Sood. I'm so excited to have you here today. And I want to just start off by even talking about the Amen Clinics. Some people may have heard of them, some people may not. But what is it that the Amen Clinics do primarily?
Yeah. So first off, thanks so much for having me. Really excited to be here. And I've seen your some of your podcasts, Rachel, and I just love how like it's just so conversational, right? So
Hmm.
let's like my hope is we can make this as informal as possible and as just kind of relatable as possible. So yeah, so my background, I'm a psychiatrist, been at the clinic for, now almost 10 years. And what we do at the clinics is we try to use a, holistic approach, right?
Mhm.
So we use a holistic approach. And I think what really, the big thing about kind of what we do is we use imaging, so brain imaging. We actually look at the brain,
Yeah.
um, and we use that to sort of inform treatment. So we use this type of imaging called SPECT imaging, which I can get into a little bit later, or
Sure.
yeah,
Well, yeah. And so I think what's interesting from my knowledge of SPECT imaging, I mean, in the mental health world, I don't know of anybody else that's using imaging in the work. Is that correct?
yeah. So so Dr. Amen started using imaging in 91. And
Hmm.
really since then, no one has used imaging, which is quite frustrating. But actually now out of Stanford, they're actually using imaging
Mm.
to subtype different types of depression. So people are finally realizing that we actually want to look at the brain to help us understand and address these complex conditions. So yeah, you're absolutely correct. No one's has really looked at the brain, but now we're beginning to look at it
And it's
more.
fascinating because in the mental health world, when we typically are trained and learn how to diagnose people, that is all largely based on symptoms and symptom
Yeah,
clusters, right? So there's a lot of like how patients are reporting things and how doctors are hearing that. And
right.
this SPECT scan gives us, I guess, more definition, something more solid to go on.
Yeah, absolutely. So, conventional training is such that you kind of talk to. So when I did my training, my residency, my fellowship, um, uh, we would talk to people, we meet with people, we would give them some questionnaires, we'd
Hmm.
sort of measure them up, categorize them, and then sort of say, you need this treatment, which was usually some sort of psychotherapy and some sort of medication.
Yeah.
And like you said, that could be, depending on the day, that person could answer a question one way, depending on how the clinician is feeling, depending on how
Hmm.
they use the world, they're going to kind of then, maybe make that diagnosis. So, with SPECT, we're using more what we'd consider more objective
Yeah.
sort of, and we're using a database. We're it's an iterative process, and we're not like just like, oh, this is it. We're continuing to learn. So I think it's definitely not something we want to do alone on its own. Like I never can never look at a scan and just diagnose someone. I think the human
I
condition is way
see.
too
Yeah.
complex for that. But yeah, we
Yeah.
want to combine the different modalities. Yeah, to
Okay.
better. Yeah.
And so, how did you get into this work? I'm curious to hear your story.
Yeah. So I was, so like I was saying, I was trained in New York City. Did my training from 2009 to 2014, and loved connecting with people that you're working with. You want to help, but I just felt like I was just a pill dispenser, almost like a drug
Mm.
dealer. You have this condition, here's a drug. Here's Prozac, here's Adderall, here's another drug, and definitely not against using medications. Believe that there is a time and a place for that, but I felt like we needed to sort of think about things in a more nuanced, complex way. And one day it was just like watching TV, saw Dr. Amen, and really one thing that stood out was when he said like the harder you try, the harder it gets, and that's something we sometimes see in a certain
Mm.
type of ADHD. And he showed an image of someone's brain when they weren't concentrating and they were concentrating. And then when they were trying to concentrate, the front part of their brain dropped out. And I was like, wow,
Hmm.
that's such a cool analogy. And like they're literal brain changes. And it'd be cool to kind of get, understand this a little bit more. So that kind of sparked an interest.
Okay. And then how did you get in touch? How did that go? Did you watch that and like apply for a job, or was it more of a process than that?
Yeah. So watched that, kind of reached out, got connected with the clinic, and yeah, I was like, should I do this? Should I not? Because people,
Hmm.
it's not sort of the way we're conventionally trained. So that I just sort of took a chance, and yeah, yeah, we're here now. But that was a pretty cool journey. Beginning, yeah.
Yeah, that is. So I'm wondering a little bit as you've done this work, um, what do you notice? Like what's different about your day-to-day job from feeling like you were just prescribing medications to now utilizing the SPECT scan, and how's your treatment approach different?
Yeah, I think one of the major ways in which things are different is people are actually able to see their own brain,
Mm,
right? And that's kind of like how often does that happen? How often do we really get an insight into like what's going on into our actual mind? So people actually see their brain. So when I'm maybe wanting to sort of intervene or give a recommendation, there's more of like, okay, this is why,
mm,
right? Um, I think another sort of cool piece is like we're not just relying on here's a medication or here's a supplementation or here's some fish oil or whatever it is. We're also talking about sleep. We're talking about exercise because they have such significant impact on the brain, positive impacts. We're talking about how substances can affect the brain. So
mm.
I think it just sort of increases your sort of ability to sort of talk about these things that are so important because they directly have an impact on brain function.
And do you see people understanding their own conditions more then because they can see it on the picture?
Yeah, definitely. I think people have more of an understanding. People have a desire to understand themselves more. Feel like people also maybe pathologize themselves less. Like,
Mm,
maybe they see their OCD in a different way. Maybe it's not just that they're obsessional and, compulsive and that leads to dysfunction, but they're also persistent and strong-willed. So there's also positive things that can be gleaned from this. So
right.
yeah.
So I'm thinking about people that might be listening and they might be saying, okay, if I were to go in and get a picture of my brain, like, first of all, what would be a reason to do that? And then, second of all, like, what kind of information can people expect to get by doing that?
Right, right. So yeah, I think before even getting your brain scanned, I think if you're considering it, do a consultation with us, right? Not everyone needs a brain scan, right?
Yeah.
I think that so have a discussion, right? What are the pros? What are the cons? Um, I think if you've gone through like many treatments and things you're still struggling, potentially this could be helpful, right? So what are the limitations of a scan? So if someone's coming, so this is a functional imaging modality, so meaning we're looking at blood flow. Um, so if we're you're looking to sort of figure out whether you have, and this is a maybe a terrible analogy, but looking to see if you have like a sort of certain tumor or cancer, we're not going to be able to pick that up with a scan.
Mm,
Um, if you are trying to, diagnose a specific like infection, we're not going to be able to pick that up. We may say, okay, your brain's has decreased activity, which may be related to infections. But where we can be helpful is really helping people who've been struggling with depression, anxiety, PTSD, maybe they had a brain injury and they've gone to, see, a variety of people and they're just not getting better. Uh,
mm,
so I would say kind of just, I think the first step would be to, you know, consultation first and then maybe go from there.
yeah. Yeah, and then can you give some examples of like, you mentioned that the Stanford study was looking at how to differentiate different types of depression. So, what
right?
kind of information do people? I mean, I know that's a very broad question and it's
Yeah,
going to
yeah,
be
yeah.
individual, but can you give a few examples of what kind of
Yeah.
information people might come away with?
Right. So, without trying to go into too much sort of high level detail, but I think sometimes getting into the nomenclature is exciting and you
Yeah,
can
we
talk
can
about it
go there.
later. Let's talk about like, so you have, so we look at the brain and we try to understand the brain from a system standpoint, right? So like you said, we have symptoms, but where are those symptoms coming from? Where are they emanating from? So we look at several structures. We look at the prefrontal cortex, right?
Mm-hmm.
So that's involved in decision making. It's like the CEO of our brain. We look at the limbic brain or the deep
Mm,
limbic system or the thalamus. So when that's active, people can be more prone to depression. We look at the basal ganglia. When that's active, you can see a little bit more anxiety. And then another part, and I'll stop after this, but we look at the cingulate cortex, and when that's really active, people can really get stuck on thoughts. So by looking
mm,
at those structures and sort of understanding how those structures are at play and how there's interplay, then you can intervene more, maybe more effectively. So
okay.
yeah,
So
so
you might see some areas overactive or underactive or interacting with each other well or not so much at all, that kind of thing.
exactly. So yeah, so you may see underactivity in the focused part of your brain, and then overactivity and an anxious part of your brain.
Hmm.
And so that can, right, lead to different presentations.
Yeah, that definitely sounds like it can. And then I know we had a nutritionist from your clinics on the pod a few months ago, and so I know that nutrition is a piece of your treatment. But can you
Right.
talk about, I know you said medications are also a piece of your treatment. What, I know it would look different for everybody again, but what's just an example of maybe some areas that treatment might look like for people after they get a scan and sit down with someone and have it
Yeah.
evaluated? What can they expect then?
Right. So I think I believe that this should always be collaborative. Um, it's very easy for me to come in with my agenda and say this is what you need, but I think it's important to understand where a person is from on a motivational level,
Mhm.
right? If I sort of say you need to go exercise and they have no desire or no will to
Mm,
exercise, right? That recommendation is kind of just a very basic recommendation. So I think meeting people where they are, we try to like in an ideal, like if someone's really, wants to, we'd love to work with people on the sleep level, on the nutrition level, on the physical activity level,
mm,
um, understanding how EMDR could be effective, a certain
mhm.
trauma therapy could be effective. So really kind of multimodal, um, but really working with that individual who comes in and seeing like how we can, yeah, effectively help them.
Hmm. Yeah, I love that.
Yeah,
So what I'm curious, in an ideal world,
right.
where do you see mental health treatment going? Like, what would your sort of, if you could have a magic wand, what would mental health treatment look like in our country? I know it's a big
Yeah.
question.
I think more access.
Hmm.
So so everyone having access. And I think so that's one thing. In effective access, right? Not just access, right? Some
Right. Oh, right. I'm really
effectively,
glad you said that. Hmm.
right. Not just just now you see someone and that person may or may not help you, access that can resonate with the community of people, right? I may not be the right fit for everyone, so who may be that fit? Um, I think I do believe in using technology to sort of help disrupt this and help this. So I believe in kind of like using generative AI. It'd be great to sort
Oh.
of use AI, have coaches, and then I was sort of thinking ahead, but coaches to sort of intervene with people 24/7, right? A lot of our work is asynchronous, meaning like
Mm.
much of the stress doesn't go on during the time of the appointment. A lot of the stress occurs in between appointments.
Yeah.
So, how can we asynchronously connect with people? So AI coaches, maybe sort of, yeah, this is like next gen, but like, um, AI clones of like of a therapist like yourself, right? So who can like speak your language, who can help more people, and then you can supervise, so that's
Mm,
really kind of like out there, but I would love to kind of.
wow. And what if they say something I wouldn't agree with?
Right, right. So there's like there's risk there for sure.
Yeah,
I think in an
yeah.
optimal world, like where we could sort of have more of the effective people who are delivering care and ensure that they deliver good care so that they're going to help more people. Uh,
Hmm.
so that's where I would use the tech piece. I think as a society, we've got to, I would love for us to slow down, right? I think
Mm,
we, I don't know, I think country's really stressed. The country's really divided. So there are other facets
yeah.
there that I think kind of seep in.
Yeah.
Um, but yeah, there's a lot that needs to be done. But yeah, well,
So
what about
where,
you? What about you? What do you
oh,
think? What are some
I know
yeah,
I mean, I've started this podcast to try to get ideas, right? And so I've been
yeah,
listening
yeah,
to lots of different people, but I think one of the things that I see is that we need some ways. I'm not sure about AI, but kind of along the same lines of what you were saying, we need ways to do more group work or to have sort of like stages, almost be able to triage people where they start maybe in a group and then
uh-huh,
the more distressed people might go to a different group and then we might have individual after that. There might be a way to reach more people from a group,
yeah,
doing more groups. Groups are complicated for lots of logistic ways, and reimbursement ways and all of that. So that's a whole other
yeah,
thing. Um, Also, something very interesting that I'm interested in is the idea of checkups, like prevention,
yeah,
right? Some kind of checkup, mental health checkup, like you get physical health checkup, and that could be a way to catch things earlier. I imagine you see what I see, that a lot of times by the time people come into therapy, they are pretty severe in terms of their symptoms, or if they're coming in for relational issues, that relationship is like on its last leg, right? And then they
yep,
come in and
yep,
they want to try to rehabilitate that. And it's difficult
yeah,
at those levels,
absolutely,
and treatment's longer, right? So I do think also looking on that prevention side, what could we do for someone to catch something that's a start of depression, right? But it's not severe at all, and after maybe just a couple sessions they're feeling better.
that's awesome. Yeah. Because once you're in like that hole, it's really, really hard to dig yourself out. You know that exercise is good for you. You know that nutrition is probably good for you. Maybe there's a med out there, but actually, feeling better and it's if you intervene earlier for sure. So
Yeah,
like brain health checkups, kind of like that. Like,
yeah, exactly.
yeah, yeah,
I
super
mean,
cool. Yeah,
you could do a scan of everybody once a year. I don't know if you need to do it that often,
yeah,
but
yeah,
right,
yeah,
that could be.
yeah,
I know that might be expensive, but you know what? That leads me to a question.
yeah,
What are the barriers for this? I mean, I've known about Dr. Amen for a long time,
yeah.
and I've always wondered, why is this not more widely used? Why is this not standard of care?
Right, right. So, so I think the emphasis so I'll speak to just kind of psychiatry, right? Your training is very much DSM focused.
Yeah,
So DSM is the
mine
book
too.
you use,
Hmm.
your book, our book, that lists out these symptoms that are very easy to identify with, right?
Hmm.
Um, but like you said, they like look at symptom clusters, and then from there it sort of tells you, okay, if you meet this criteria, you have this condition. If you have this condition, here's the treatment. And big pharma, which helps us sometimes, do prescribe medications, not against medications, um, loves this methodology
Mm,
because it says, okay, you have depression, here's the drug for your depression,
right.
right? You have ADHD, here's the drug for your ADHD, right? Psychosis, we have a drug for that. So then you're sort of indoctrinated in this sort of phenomenology.
Mm,
And it makes sense, and it helps, a select number of people,
some people.
some people, but many people um, don't get better with this sort of approach. So as a result, if you're using that one approach and not really entertaining other approaches, um, yeah, you're gonna essentially be blind to sort of realizing that there's
Mm,
actually an organ there that could
yeah.
be to that presentation. So I think that's part of the issue is that early on you're not getting
Mm,
that training. You're not
mhm.
realizing that the brain is involved. Um, you're never taught about these structures, and if you are, it's maybe for an hour, 1 hour over the course of 5 years of training. It's like crazy. It's mind-boggling. So I think that's one.
Mm,
Um, I think cost is a barrier.
right. I
So
figured
this is
that
not
one.
covered by insurance.
Yeah.
So that will be, if we can get this covered by insurance, I think that will make major difference,
Oh, yeah.
right? And so more research is going to be needed, more beyond us just doing this, other people doing this. I think that's going to help,
Mm-hmm. Okay.
right?
Yeah.
So with the work that's come out of Stanford, it's sort of exciting to see that people are kind of realizing that the brain is involved. But yeah, I think those are a couple of barriers to sort of getting the brain scan.
Mm, that makes sense.
Yeah.
So, what are you passionate about going forward? What are you wanting to invest in? What do you have any specific things you really like to spend your time treating or researching?
Yeah, I mean, I bring up AI, and I promise you, I'm not like the most technically savvy person. Like I'm not someone who not engineering mind by any means, but I do like how if we can leverage AI to reduce cognitive load, so
Mm,
we can really as the human work on the human connection piece. That's what I would love to see. Um,
interesting.
and we have to make sure that what it feeds us is there are no what we call hallucinations, and it's you know not just plausible but actually helpful. But yeah, to really reduce cognitive load to then be able to connect with their clients, really sort of get a feel for what they need. I mean, I think there is a part of what we do where there's a science, but there's always almost this art too,
100%.
right? For me, like in any encounter, therapeutic alliance is the number one thing.
Hmm.
You know, well, if someone's their thyroid's off, my therapeutic alliance is going to be different, but that's a foundational piece, right?
Yeah.
And I think so. Yeah, I'm kind of excited about the opportunity with AI. I think decreasing stigma, intervening early is another thing that I'm excited about. But yeah, those are
Okay.
yeah,
All
yeah,
right, I like it. I think, yeah, and being smart about AI and ethical about AI, right? It's interesting
yeah,
that because you mentioned AI in order to reduce cognitive load so that more time can be spent on human connection, right? That's
yeah,
interesting to me because
yeah,
AI potentially could also take away some of that human connection,
yeah.
right? How we use it seems very
How we
critical.
use it is essential, right? Right. We don't replace the human piece, especially in a post-COVID world where isolation is,
Hmm.
yeah, we're in that sort of crisis.
Right.
Yeah.
I'm gonna pause for a minute.
Yeah. Sorry you're feeling this way. Gosh. Yeah. Yeah. Oh my gosh. You're still doing this podcast.
I know, right?
Yeah, you're
What am I
like,
thinking?
oh man. Gosh.
Don't worry, they can edit all that out.
We can edit it
That's
out.
the
Yeah.
beauty.
Yeah.
Yeah,
Yeah.
I'll just be like, hey,
Yeah.
coughing quit fit to edit out. We were almost finished anyway.
Okay. Cool. Cool. Cool.
um, all right. So, as we are wrapping up, I
Yeah.
would love to ask you if there's anything that you would like to share with our listeners. Maybe some
Yeah.
tips for their brains, um, maybe some big ideas about new things or trying
Yeah.
something new. What would you most want people to take away from this?
Yeah. Yeah. There's so much, right? Yeah. I think the one big take home could be, since we look at the brain, is that your brain is involved in everything you do. So like, kind of, when you're making decisions, think about those decisions with your brain in mind.
Hmm.
So like, for instance, your thoughts, right? How you think can affect how your brain um, feels. And if you think negative thoughts, that can strengthen kind of negative parts of the brain. If you think positive thoughts, that can calm down certain areas in the brain. So how we think matters. It can be challenging to think positively, though, when we're
Hmm.
suffering. So not to seek help if it's um, just insurmountable. Um, yeah, I think, yeah, internalizing less and just being more open and more vulnerable, right? Um, things are important. Um, but yeah, I think really to think about our decisions with our brain in mind, right?
Yeah, excuse me. I love that. Thinking about what our brain needs almost
Yeah,
as we're
yeah,
going through our days.
yeah, absolutely.
Well, Dr. Sood, it was such a pleasure to have you today. Thank you for bearing with my
Yeah,
scratchy voice.
yeah,
And if people want to contact Dr. Sood or find out more about what the work he does, it'll all be in the show notes. And it was just great to have a conversation with you.
awesome. Thank you so much, Rachel.
Thank you too.